Welcome, everybody. And this is a first. Never done a webinar on Sunday. Thank you so much for coming. And this is the first of hopefully a series of events on patient advocacy. And this is actually something I'm kind of, it's very new to me. Because normally I produce events in healthcare, health AI. And I had, we all care about patients in healthcare in that world. And professionally, when we have events, we mention them, but the conversation tends to revolve around regulatory buy-in, operational buy-in, clinical buy-in, financial buy-in. Those are the sources of authority with the power to say no to change. So they dominate the conversation, and we'll just mention patients. Now, I'm going to bring on our first speaker. And by the way, I'm killing time because we're still letting people in. And I'm going to bring on Shanise, who was the first patient advocate I ever met. Hello, Shanise. Thank you so much for coming today.
Hey, Jose. Thank you for having me.
And, a massive light bulb went on when I met you, because when I met you, I was going in thinking, okay, Shanise is going to be a source of information. This is I come from the technology world. You get information from patients, and then you deliver services. What the light bulb was like, oh wait, she's a source of leadership. I wasn't expecting that. And it actually didn't have, it was like, it actually came to me like when I was editing the video. I said, wait a second, she's the leader. She's not somebody you kind of query for information. And and I've featured on a webinar before. Thank you so much for coming. And that's why I brought you on first. And I'm still learning. And I'm wondering if you could, have I introduced you well enough? And also, I'm at one of your events, the Advocates Table. I wonder if would you mind telling us a little bit about the Advocates Table before we start?
Sure. The Advocates Table is a business that I created when I was going through my breast cancer journey, and it is my passion project. I turned my pain into purpose, and the Advocates Table is a community rooted in healing, early detection, and patient empowerment. And so that is why I'm here to discuss a little bit about my journey and why those three areas that I talked about are very important to me as a person and as a patient as well.
You know, one of the, I'm wondering if you could talk to us a little bit about how, about people, how should people advocate for themselves during treatment? I know people they're in shock. Am I going to die? And then you're actually having the treatment, and you can have brain fog, confusion. You don't understand all this technology and terms and tests you're going to, and it can be very reactive.
Hmm.
And but then you've got and I think you advocated for yourself, you led your treatment,
Right.
and what advice do you have for people who want to do that?
Sure. So I will, just for those who are just joining, I'll just go ahead and let everybody know again. My name is Shanise Pearce. I'm a wife, mom of three, the founder of the Advocates Table. Again, is a community that's rooted in healing, early detection, and patient empowerment. I am also a survivor of triple negative breast cancer. I want to give a little bit about my story just so that people know if you don't know where you came from, you don't know where you're going, right? So my journey started back in 2020 when genetic testing revealed that I carried both PMS2 as well as the BRCA2 gene mutation. That changed everything for me, where I began preventative care right away, including a hysterectomy. And in October of 2023 was when I was diagnosed with triple negative breast cancer after a breast MRI. I went through 12 rounds of chemo, a double mastectomy, and later deep flap reconstruction surgery. But my story isn't just about cancer, it's about how I fought for myself, as Jose stated, how my family stood beside me, and how creativity gave me the space to heal. And that's what I'm here to discuss today. So, how did I advocate for myself during treatment? So advocating for myself meant that it meant to refuse to be passive in my care. When I received my diagnosis, I had already learned how to ask questions, get second opinions, and speak up when something just didn't sit right with me. I didn't wait for anybody to take charge of my healing. I chose to be that person myself. I brought someone with me to my appointments to take notes, ask why things are being done, and made sure that I understood the long-term impacts of every decision that I made. And if anything was made on my behalf, I said no to things that didn't align with what I needed. And I said yes to learning more, even when I was scared. Advocacy isn't just about demanding things, though. It's about knowing you're allowed to take up space in the room. Your life is on the line, so you deserve answers. And if the answers that you're getting aren't enough, then you deserve better ones. And that's what self advocacy is to me.
And thank you for that, Shanise.
No problem.
And I remember something you said to me. You talked about the village you have around you,
Yes.
and you also talked about you're meeting people who've got cancer all the time, even though you no longer have cancer. You're going into the hospital
Mhm.
and you're seeing people
Yes.
in the room. How do you use leadership in that village you have around you to
So, yeah, to advocate for myself
yeah
and for others. And
for
for others, yeah. So leadership for me wasn't about me being strong all the time. You know, people always tell you, "Oh my gosh, you're so strong," and then inside, I'm like, "Oh, right?" So it was about being honest and intentional, right? I had to guide the people around me, well, you know, my village, so that they can support me in the ways that I needed it most. My husband, he was my caregiver, he was my anchor, right? He helped manage my medications, he attended appointments with me, he kept me fed, he kept me rested, and he also held space for me emotionally when the weight of everything got too heavy, as well as other family members. That was leadership in partnership. Our children, they carried the emotional side of my diagnosis. They learned how to be present, how to sit with pain, and how to love me through everything. I gave them space to be vulnerable while also showing them it was okay to be afraid and hopeful at the same time by me explaining everything that I went through to them. Even our son, who was only 14 at the time, letting him be there every step of the way to understand what mommy is going through so that he was able to ask the questions as well. And even at work, for me, leadership showed up. My boss, she took the time to understand my schedule for my appointments. I put them on her calendar and always let her know what I was doing, when and where, and my post treatment fatigue. She knew how to support me because I communicated with her clearly. I was very transparent. And for me, that's the key: clarity, trust, and the courage to ask for what you need. Sometimes leadership is saying, I can't do this alone, and I'm going to guide you on how to help me. And that's where the power comes in.
I've been to one of your events, and one thing that really struck me was we did a coloring exercise,
Hmm.
and I think when I first when I was like, coloring, really? And I was like, okay, I got one. I had a fine colored pencils, right? I was like, wow, wow, I haven't never done this before. And I wonder if you could talk about tapping into creativity and using
Sure.
creativity and but that was you. I mean, that really blew me away.
Well, it blew me away too because I didn't know that I would use coloring in this way. I had a very good friend who, when you're sick, people come over and say, "Hey, I want to bring you this gift." And she brought me a coloring book and colored pencils. Excuse me. And I was like, what is this? I'm not going to be using this. And then I started to color and I was like, oh my God, it was so amazing. So healing wasn't just about what was happening in my body, it's about taking care of your mind and spirit too. And that's where coloring became a lifeline for me. It gave me something that I could control when so many things felt uncertain. I can sit in stillness, focus on a single line of color and give my brain space to rest. When I color, I only think about what I'm doing at that time. And you can use whatever it is that makes you happy to color. Like you can use paints if you want to. I personally use magic markers. I tried all different types of things. Coloring pencils, I didn't like it. It was too light. Crayons, I really felt like I was a child with crayons, but magic markers were something that I felt like I could control the colors. And as I colored, each page helped me feel present and whole, even in the middle of a storm. Beyond coloring, I leaned into journaling, creative writing, music, affirmations. So on my event that you attended, I had words of affirmation to help. I had some music along with those words of affirmation. And these healing outlets helped me process grief, joy, and everything in between. I wasn't just surviving, I was actively creating a space for peace and purpose. That's why I now center creativity in my advocacy work. Are dance. I have a daughter who dances. And so that's something else that I'm going to be incorporating into my advocacy work. Poetry. I now also have a podcast on YouTube where I have poems that I use to help me release, just for a sense of release. These are tools of resistance and recovery for me. They help us find ourselves again, and that's the kind of healing every survivor deserves.
That resonates with me was like you touched on change, processing, and it's difficult for people to process change. And one way to do that is with some kind of ritual, some kind of narrative. And what about somebody who's like, maybe they're like, oh, I don't want to do coloring, but they want to explore some kind of creative outlet, but they're kind of feeling like, oh, what? And it's almost like there's too many options.
Hmm.
You know what I mean? And it's almost kind of daunting, and then it becomes like almost like it can be quite crippling. Like, oh, I have to do something creative. What? And it's like, oh, it becomes another job.
And that's why it's important to know what works for you. Coloring worked for me. That doesn't necessarily mean that that will work for everyone. Do something that comes to easy to you, right? Not something that you have to work hard at. If exercise is that thing, go ahead and do that. Make sure that it's something that gives you that release that you're looking for. If you're still feeling like it's a job, then that's not the thing that's giving you a release. It's adding more stress to an already stressful situation. So you have to channel what makes you go and what makes you feel at peace. And whatever that is, then go for it and do it. So I'm rooting for everybody. And please feel free to definitely reach out at any time. I am here to support you as well as all of the other guests that are amazing that I know personally that are on this call as well. So, yes, thank you for letting me share my heart with you, Jose. Whether you're newly diagnosed, a caregiver, or a supporter, remember this: you have the right to ask questions, the power to lead your village, and the ability to heal in ways that make you feel seen, heard, and whole. And I'm grateful to be here, and I'm rooting for everybody.
Thank you, Shanise.
Thank
Well,
you.
I've put Shanice's LinkedIn profile in the chat. I think most people are on LinkedIn. I know some people aren't. We're going to bring Shanise back. We're not getting rid of her. And Now I'm going to bring in our second guest. And hello, Chad.
Hi,
Welcome. And
thanks for having me.
I've spoken to Chad before. I've actually had you in I hosted you in a webinar that was a bit more technical. We were talking about AI and living guidelines, and you're an oncologist, but you're wearing a different hat than most oncologists do. Well, I mean, you've worn all the hats, I think, in oncology, and I think a lot of people don't know about the hat you're currently wearing. By the way, have I introduced you well enough? Maybe you want to add to that and describe the hat you're wearing.
Sure. Well, thanks again. It's an honor to be here with these other guests who are strong, experienced, empathetic. It's a wonderful topic. It's growing immensely. Patient advocacy, specifically. I mean, probably the first statement out of the gates would be that whether you know it or not, as a patient here in the US, be it cancer, chronic disease, acute care, even regular medicine, um, probably everybody needs and deserves an advocate of some sort. Like Shanise was saying, you can find your own, you could seek out many of us that are starting to dive into this space. I'm a practicing oncologist for 23 years. Have worn most hats in academic, community setting, private settings, run departments and tumor boards and clinical trials and all the things that your average or common oncologist might be in a role of. A couple of years ago, however, with the institutionalization or the corporatization of medicine happening, as many of us have experienced, I set out to decide start something a little bit different that I thought really was needed. And it's filling this space for patients and their families and their support team to really feel empowered and advocated for. I mean, I'm specifically in the cancer advocacy space. Our practice on CareMD is staffed only by physicians, and we have no incentives other than the patient's best journey. Compared to the typical doctors in the hospital who somehow are tied to insurance plans or pharmaceutical prescriptions or ordering tests or their employment or the referral doctors and the patterns that they have, or the treatment that they recommend. And I wanted to cut through all the red tape of that and really just get down to helping patients with what I felt was going to make more of an impact. And over my career, the origin story really is that most oncologists, we help one or two or more friends and family every month probably who have a new cancer diagnosis. If you think about in the US this year, there's going to be over 2 million new cancer diagnoses, um, just in this year. And everybody's one step away or touched by someone with cancer in their lives or themselves. And what happens when you hear that C word is it's scary. You're kind of drowning in information overload, be it from your family and friends and support system or the doctors. You don't really speak the language, so there's this urgency that accompanies all of it as well. It's really overwhelming and traumatizing and hard to prioritize what is the most important next step and how do I become educated so I can be an informed consumer of healthcare, which is what Shanise was kind of alluding to. I mean, the way I say it is that unfortunately the landscape is such that most of your treating doctors are so busy juggling so many things that in essence they're spread thin, and it's not to any blame of their own. um, they just don't really have the capacity to take care of us all in the way that we as individuals would like or deserve, which is in a very personalized manner. Every patient and their family comes to a cancer diagnosis or any big medical diagnosis with their own personal background, history, philosophies, beliefs. as a person, as an individual. And then additionally, what's specific to their disease is extraordinarily unique. So it's really hard to offer cookie cutter based treatment based on statistical analysis and studies and things that touches on every aspect of healing and living and wellness and trying to achieve a cure, or just a more smooth, error-free experience as you're going through everything that lies ahead after a cancer diagnosis. So what we seek to do, and what we do is by being unincentivized, other than a membership type of service that we offer. We're not tied to any of the treatments, any of the tests, and we are experienced expert oncologists in many aspects. And you only deal with us as oncologists. It's not just social workers or nurses or navigators, often who are incentivized by a system or an employer that provides them to help a patient navigate through one hospital system. So we started this practice up, and we've been helping patients now for a couple of years. And it really is a unique opportunity and a privilege, because I can spend more time now with patients than I've ever been able to. There are so many unique aspects to each patient's journey that require both a medical experienced knowledge base, as well as an empathetic and experienced ear on how to navigate through all of this. So what we do is we try to, our mission is advocacy through education. Now, we act as a liaison as well between the patients, their families, and their treating doctors. And most of the doctors, once they realize that we even exist, because a lot of doctors say, well, I'm your oncologist, why do you need another one? Well, we have the time, the space, and energy to focus only on a handful of patients at a time, and spend as much time as it would take for each patient to develop a strategic plan and feel supported in the execution of that plan as their journey proceeds. And it's a very simple model. It was just cutting through all the red tape and giving patients after hours, over the weekends, holidays, whenever, in the comfort of their own home, the opportunity for experienced team of oncologists to dive deep into their medical records. We obtain their actual medical records. We go through them with a fine-tooth comb, make sure that all the I's are dotted, T's are crossed. With the amount of scientific innovation and advancement that's happening right now, there are so many exciting things to individualize in what's called precision oncology, or whole person care, that it's quite overwhelming for a doctor, much less a patient and their family, to go through. So after we've done that, usually within 2 to 3 days of meeting a patient and their family, we spend 2-3 hours developing and listening and being present to get to know what's unique about them, what's important to them, what's going on in their lives when this occurred, to develop a language and a fluency with what's happening on the medical side. We develop a strategic plan with them that they can then take with them to their treating doctors' visits, their consultations, the number of different appointments that all of a sudden get on their calendar. And we basically help point them in the right direction at the start. Now, that a second opinion is actually kind of easy to get. There's a lot of people out there giving opinions and can decipher the extraordinarily large amount of medical information and options. But what we really found was in the execution of that treatment plan, with every twist and curve that they might encounter as they go through treatment, diagnosis, or further diagnosis, treatment, management, and then survivorship thereafter, where you're just trying to keep them cancer free once hopefully you've helped get rid of the evidence of the original diagnosis. By having lots of touch points, we meet with patients in the comfort of their own home. by video or by email or phone or text, whatever modality they find easiest and most convenient in real time. We can address questions, concerns. When their friends or family say, you need to go here, you need to talk about this, or you need to look into this, we can quickly decipher, because there's very little that we aren't quite familiar with. Now, taking care of the whole person requires a certain ability to listen and experience to kind of know, okay, what are the implications of that person's unique, identity, characteristics, personality traits, preferences, beliefs, etc. So we meet with them before every doctor's visit, before every scan, before every test. We develop a short list of bullet points to help them ask the questions the way they would like, or the way that it would be most understood by their treating teams. And then we debrief with them after those visits as well, to make sure that we stay on track, that nothing is confusing or gets missed, or isn't explained in a way that the patient and their family really leave feeling like they've got this plan. Ultimately, by doing that, we seek to shoulder most of the anxiety and the stresses that are not related to just their wellness and their healing and their living. You live with a diagnosis and hopefully continue on in spite of it. And that doesn't always occur. But by helping patients really feel like all the diligence has been done with a team of doctors that have not had any incentive other than to just help that patient, and we can talk about all of the treatment options, not just what's offered at one facility or another. Our network of physicians and support teams is quite extensive, and it's not very difficult for us to help patients, if they need to, find a very experienced expert type of team to treat them. Believe it or not, the treating is probably the easiest part about helping a patient with a cancer diagnosis today. The ability to make sure the workup and the diagnosis is done in as much detail as can and should be today is a large amount of work. And then really sitting with the patient during what is often glossed over as the informed consent step, which to me is where so much of the important decisions are made. In order to make a decision, an informed decision, a patient has to understand what all their options are. And then you have to weigh the pros and cons, the risks and the benefits of each of those options to come up with what you want as your own treatment plan. And this isn't alternative medicine. This is standard medicine complemented by experienced integrative options and other aspects related to nutrition and exercise and sleep health and stress management and mind-body medicine. All these things actually make a big difference, as one might imagine, while you're going through the treatment. And the treatment being, in my mind, the third step, being really good at treating a patient the right way with experience and confidence is an important task, but that arguably can be researched quite well, and the patients can go and kick the tires in those teams themselves. So the way I kind of talk about what Shanise was talking about was that, believe it or not, patients need to feel empowered to be the squeaky wheel. Doctors are spread so thin that to give all of the time that we each would like and deserve related to the aspects of the care that I was just describing is not really even realistic anymore. So we've created a space for patients, doctors, family members, and support teams to really have unfettered access and time to dive into each and every aspect of these cares. And if we're not already very experienced with it, we are able to point them and connect them with the right people who are, like my panel members here. So that's kind of what we do. Our message is healthcare today in the landscape is not much different than any other corporate entity. And if you were to go buy a TV or a car or a pair of shoes, you're going to have the opportunity to weigh the pros and cons and become an informed consumer. It's very difficult to do that ahead of time or even in real time with a cancer diagnosis. So the messaging is really feel strong enough and be confident enough, and we help you do that as well as many others, to be an informed consumer of your care and expect a certain degree of customization, precision that's catered to you and the way you feel. And sometimes there's a lot of urgency where you don't have the time, but with cancer diagnosis, most of the time, this is the beginning of a long journey. And you need to feel heard. You need to feel like you can have a good line of communication with your treating doctors. And you need to be able to speak the language in a way that expresses to the doctors with their limited time what it is that's going on and that you'd like to, talk about or at least consider. And it makes a huge difference. I mean, we know from helping friends and family all the time, it makes a big difference. And so my practice, our practice started out of that. And it just was really to fill the gap of, well, why is it just for someone who knows an experienced oncologist who gets to have that kind of opportunity? Why don't we try to make this accessible to everybody? And that's what is kind of surging in the community space right now, is this patient advocacy topic. And it's early, it's important. It's only going to become more important as sort of the institutional aspects of the landscape continue in the directions they're going in. And so we're excited to be here. We're excited to talk about it. We're excited to support patients as well as our other panel members here. And that's kind of what we're doing, what I'm doing, and why I'm doing it.
Thank you, Chad. We're going to bring Chad back for the after party. He's going to be able to answer your question. By the way, there's an after party to this event. Maybe after party is not the right word. When the webinar ends, we're going to allow members of the audience, you can put your questions in the chat. And I know we've got a couple of questions. We're going to get to them in a minute. We're running on 2 more speakers. And we're going to allow the audience to speak on camera. Thank you very much, Chad. Don't go away.
Yeah, sure. Thank you.
Okay, I'm going to bring on our next speaker and a fellow Canadian.
Hey.
Hello.
How are you?
I'm very good, actually. I didn't know you were Canadian.
Yeah, not until we met just recently.
And and you know what I learned, what I picked up from you was, and I got emotional watching the clips afterwards, actually, and was the after. And the after is big.
Mm-hmm.
The bell's been rung. It's not over.
Oh, no. It's just starting.
And that is something that, and I've been a caregiver twice. And there's so much of that was like, oh, I wish I'd known that X number of years ago. I wish I knew that X number of years ago. But not just me, oh yeah, I know all that. That's actually why I brought you. That's why I want you to talk about it. By the way, have I introduced you well enough?
Yeah, I think so. I can add a little to that.
Go ahead, add something to that.
Thank you. Thank you so much, by the way, for inviting me into this. I'm really excited to be here. So I work with cancer survivors now, including stage 4 warriors, as I call them. And I really meet people in that aftermath of cancer. But to back up a little bit, I myself am a breast cancer survivor. And prior to that, I had my own interesting health challenges, and then breast cancer happened after that. Everything was one after the other. So I had an interesting journey, should I say, and very little emotional, mental support going through all of it. So at the end of my breast cancer journey, when I, had that conversation with my doctor, and it was congratulations, you've made it and you're a survivor now, and I'll see you in 6 months. I can still feel that fear that came up for me. And I said to him, well, okay, what do I do? And he said, what do you mean? And I'm like, well, what do I do for the next 6 months if I'm not going to see you? And he was very confused. He was my reconstructive surgeon, very compassionate, very hands-on. He was amazing, but he was not prepared for that question. And he said, go live your life. And I was like, but everything's changed. I don't really understand what to do. Like, how do I do that? And he didn't know what to tell me. And then I started realizing, the more that I started meeting other cancer survivors, it was the same scenario. There's no preparation. So what happens from the cancer survivor's point of view is you get to that point where you're coming to end of treatment, and it becomes very scary for us, because your medical team, who is really your safety net, right? They step back because they've done their job. And then your family and friends have no idea what you've actually experienced. And they're like, yay, like, you're good now, right? And you're like, no, but you don't want to tell them that. So you put on this brave face and you pretend you're good. And there's this sort of unrealistic expectation for you to go back to life and resume everything as normal. Number one, you have no idea how to do that. You have no idea what just happened to you. You're not the same person. And as I call it, I describe cancer as a tornado that comes through and blows your whole life apart and blows you apart. And you go looking for all those pieces that are all over the place, but they don't go back together anymore. Not the same. So because of my own experience and because of learning about other people's experiences being very, very similar, I decided that nobody should be left alone in that phase. So that's where I come in and take their hand, and I guide them through what I call the aftermath of cancer. And I help them learn how to heal all of that. I call them the emotional scars. And what it is really is that everybody gets the treatment plan and the physical human gets addressed. But as a human being, you have a mental aspect, you have an emotional aspect, and a spiritual aspect. And with the physical, that is then a whole person. So I come in and I help them put those pieces back together.
Thank you for that. And you probably didn't see this, but you're from Canada too. I remember it was a long time ago. Some group of nurses in Canada, cancer nurses, they put out some kind of statement saying, if somebody has cancer, stop pressuring them to be cheerful all the time. And I think this is like something that comes up is people who've had cancer, and like you just said, they've recovered, and everyone's like, okay, come to the party, come to this, come to that, and yay. And the other person's, I can't do that, or maybe I said yes, but now on the day I just can't do it. And everyone's like, why not? Why not? And people have a hard time communicating that I'm not, even though it's different now. I have, my energy comes and goes, and doesn't mean I'm sick, but people have a hard time, I think. Can you have any advice for that, for like, especially like people who aren't the caregiver? They're that circle, and the person who's recovered from the cancer, they don't want to lose their friends, but sometimes it's difficult to communicate where they're at with people and manage expectations. And they don't want to say, sorry, I'm rambling.
No, you're good. Actually, that's why I talk a lot about boundaries and understanding that boundaries are really important and they're really healthy, but we're not often taught how to make boundaries and that they're okay, that they're a healthy thing to do. So I teach people that. But before anything, the person who's just gone through it, the key part that I find is often missing is they don't give themselves permission to be really upset, to get really angry, to be messy. A lot of people that I work with, they tend to kind of feel like they need to stay strong and hold it together for the sake of everybody else because they're expected to be brave, and they don't want to, in their words, they don't want to show they're ugly. They don't want to break down and start crying. They don't want to describe that, their brain doesn't work the same way anymore. Their body doesn't work the same way. They feel like a stranger inside their own body and they don't know what to do about that. There's such a big conversation around that question. The people outside of the person who's gone through cancer, especially if they're more further back, like friends, for example, or family that wasn't like right in there, they don't understand because it's not really often spoken about openly what happens going through cancer. So I don't think it's anything of their fault either. It's sort of like this unknown gray area that not a lot of people really understand how to navigate. But I think asking questions from both sides is really important, just being honest. But being honest requires a certain amount of vulnerability that takes a lot of courage. And I find that sometimes people need that permission to be able to offer that, to be that, to get sort of, people don't want to show the all the sides of being a human. Sometimes it's really uncomfortable and sometimes it's not pleasant. You know, we're not, the expectation we put on ourselves to be like, oh, I'm really strong and oh, I'm really brave. It's like, we don't even want to be that, but we don't have a choice. And I think that's also misunderstood. You know, it's like, oh, you were so brave. It's like, well, I didn't have a choice. Like I faced my mortality. It was like, I did the best I could because what was my other option? So it's a very complicated conversation.
This is something I've noticed. I was thinking about the other day. And when I started the webinar, I was talking about how healthcare conversations tend to revolve around clinical, operation, financial, and because they're the people who have the power to say yes or no, to change. Patients don't have the power to say yes or no. And that's maybe why they get decent, and it's not. Sorry, that's
I don't know.
a question.
Yeah, I don't know if I would say that. I don't think I would agree entirely with that. I think a lot of times people don't necessarily know. So from the patient side, I think number one, sometimes they may not be aware that they can say yes or no. And sometimes I think they might be afraid, because I have the utmost respect for doctors, but sometimes people look at doctors as sort of like a higher human being than the rest. And I understand it, but I don't think it helps anybody, you know? So like I said, when I was going through my own cancer journey, I had those moments. I had an oncologist who tried to use fear to scare me into doing things. And when I asked questions, I was told not to ask questions. And she literally told me to shut my mouth and listen to her. And that's when I fired her, because my perspective was, if I don't feel like my life is safe in your hands, because that's what I'm being asked to do, then you can't be my doctor. It doesn't mean I don't respect a doctor, but I don't respect you with my life. Like, it just doesn't work for me. And so people, I think, need to start understanding, like you said earlier, like, this is your health, this is your life. It's really important for you to actively be participating in it with your medical team. You are a team with them. You're all trying to do the same thing, but you have a voice in that too. And I think sometimes people aren't confident in that, or they're just not sure how to kind of maneuver in there, you know, and that's where the advocacy is so important.
Can I ask you a quick question?
You can ask me whatever you'd like.
Cancer survivorship and social media. So somebody who survived cancer, obviously their friends, their close friends and family know. But a lot of people who've been through cancer, they haven't announced it on Facebook. They haven't announced it on Instagram. They haven't announced it on LinkedIn. And they're being invited to things. And they're thinking, oh, how do I let these 500 people know? I don't really want to announce it, but people are asking me things on social media. And the answer, my cancer is involved in the answer, and I don't know how to navigate that. And now I'm like, and the other thing too is also a lot of people with cancer they're comparing themselves to other people. Like, oh, she didn't get cancer, and look what she's doing now. But they don't want to be isolated. They don't want to turn off social media either, because that's isolate. They don't want to isolate themselves, but that could be a big source of stress and anguish. I don't know if you have any advice for people on how to navigate.
That's a big one. The comparison thing also goes into one person comparing their cancer experience with another person who's gone through cancer. And that's like, whoa, don't even go there, because I feel like cancer is a very personal experience, and every single person, you could take two people diagnosed with exactly the same thing, same treatment, same everything, their experience is going to be entirely different. So I think right off the bat, I just want to kind of put that there, because it's actually really common that you'll go into a group for cancer survivors or people just diagnosed or going through treatment, and they start comparing notes. And then they start feeling like, oh, I didn't have it as bad as that person. It happens in my own community. So I'm putting that out there because I also fell into that trap earlier on. And it's just a huge disservice to everybody. But in terms of not wanting to say it on social media and then having people inviting you, but you've not said anything so they don't know, there's a few layers in there. I would say it's such a personal choice. Not everybody wants to express their health history, and that's perfectly fine. So I think everybody has, again, this to me brings up boundaries. You're not obligated to participate in things you don't want to participate in. And I don't think you need an explanation for it either. I think you can just politely decline. And if it's something that happens multiple times with maybe the same person who's inviting you, then maybe at that point you might want to say, hey, I really appreciate that you've been inviting me to do this, and I really want to do it. However, right now I'm going through something and I would love to maybe in the future, but right now I'm not able. And that's really as far as it needs to go. You're not obligated to tell people things you don't want to share. Does that help?
That was brilliant.
Okay, thank you.
Thank you, Ryn. Don't go away.
Thank you.
We're going to have an after party, everybody. And when the webinar ends, I mentioned this in the chat, we are going to allow the audience to speak if they want. We'll bring them on camera. We're going to have a little chat. Thank you, Ryn. And final speaker. Oh, I can hear her already. Hello, Ebonie.
Hi, Jose. How are you?
I'm very good.
That's good. I'm just really honored to be here. Thank you so much for inviting me to do this.
Thank you. And actually, when I met you, I was like, what's this? That wasn't it. You're talking about sex. We're talking about cancer. What are you talking about? And I get it now. And I was just like, and the reason why, just like healthcare, we don't talk about sex.
Yeah.
I've done lots of, we don't talk about sex. It's just, it's KPIs and this and that and compliance or regulatory, clinic, and all these things.
Mm-hmm.
No one ever talks about sex. And but one thing I've learned from you, well, I kind of know about sex, but one thing I learned from you is that sexuality is a really important part of someone's identity.
Absolutely. Yes, it is.
Being a whole person, and cancer affects that.
It does.
And one thing that I think you said to me, maybe I'm paraphrasing, people deserve to have good sex.
They do.
I don't think I'm paraphrasing.
Mm-hmm.
And you've done a lot of work in educating people about how to navigate. It's not just about sex, intimate relationships, pleasure.
Mhm.
And that's what I brought you on for.
Mhm.
The end. I wonder if you could have I introduced you well enough?
As Ryn and Shanise said, I can, add a little bit more. As both of my, I guess my webinar mates and as well as Chad, but with Shanise and Ryn, just like with them, one of the reasons that I am such a staunch patient advocate is because I am also a breast cancer survivor. I am a bilateral breast cancer survivor. My experience is going to one institution who missed the cancer diagnosis that I had, and they found a second lesion when I went to my second opinion. And that meant within like 45 days, I was diagnosed with cancer twice. And as I matriculated through that experience, I just noticed that after my surgery, taking the medications, just simply dealing with my diagnosis in itself, was a very challenging thing. And as I spoke to more women, it became very clear that discussions about healthy sexuality and sexual wellness were really not being addressed within the clinical setting. And that causes a lot of angst in women, a lot of disappointment in women because cancer takes and takes and takes and takes. So it is important for us to to reclaim as much of our humanity as possible. It's important for us to retain as much of the happiness, the joy, and the optimal quality of life that we possibly can. So as I was navigating these changes, the scars in my body, how I felt about my initial reconstruction, the weight that I gained in response to the medication that I was on, I was just navigating so much dysfunction, if you will, and I really didn't find support. And because of that, I created my own company, which is Proud Lab, which is a patient advocacy organization that supports women and couples to maintain healthy sexuality as a critical component of optimal health. And so with Proud Lab, we aim to do 5 things. We aim to educate, and not just educate the patients, but also educate the providers about why these conversations are so important, how these conversations can be integrated into your care plans from diagnosis all the way through survivorship. And we want to make sure that we communicate to the patients and the providers that this is a collaborative exercise in making sure that the full humanity of a patient is being addressed and not just their diagnosis. Now, in addition to the education, we also want to make sure that we advance research. I just attended a cancer conference with thousands of scientists, oncologists, researchers. There were 0 presentations about sex, sexuality, and sexual health. And we're adults. We all got here the same way. Somebody had to have sex with someone else. And we want to have pleasure. We want to have joy. We want to have connection in our lives. But when you are navigating something like cancer, it is even more critical that you're able to maintain those connections, make sure that you have the proper education, making sure that you have the context for which to view and really digest a lot of the information that you are receiving at that time. Thirdly, we complement the care of physicians. We understand that some physicians do not have the bandwidth to have these conversations. It's estimated that around 9 million women are living with cancer right now in some form. According to the American Society for Clinical Oncology, there are about 30,000 oncologists right now that are available. So that means that some oncologists are seeing 20 and 30 patients a day, sometimes for only 15, maybe 20 minutes. And the focus is traditionally on survival of your disease. That is how physicians really quantify their skill level. They're able to build their reputation by making sure that they have the results that people who are experiencing cancer are looking for. And we have to be honest and say, when you're first diagnosed, you don't say, hey, I'm going to go find the oncologist that talks about sex. That's not the first thing that comes to your mind. The first thing that comes to your mind is, I need to find an oncologist that has a um, a success rate that I'm comfortable with. I need to find an oncologist that is well versed in the treatment of my cancer to make sure that I'm able to survive this experience. So, because of that lack of bandwidth, Proud the Lab is able to complement the care that oncologists provide because we understand the challenges that they are facing simply trying to ensure that their patients survive. We also want to create a community that's free of shame, that's free of judgment, so that we can openly and honestly have these conversations, because sexual dysfunction is estimated to be between 60 to 100% of women who are navigating cancer experience some form of sexual dysfunction, whether it is vaginal dryness, whether it's vaginal atrophy, whether it is a lack of desire, whether it's functioning to the dysfunction in terms of pelvic pain. So they are not able to have that physical intimacy with their significant other that they were probably used to. So there are so many aspects of our sexuality and our sexual wellness that is critical to the foundation of who we are as men and women in their entirety. So what Proud the Lab does is we make sure that we come at it from an evidence-based component or an evidence-based framework, which are the 5 circles of sexuality, which include sensuality, which is how our bodies experience pleasure; intimacy, which is the closeness and the trust and the connection that you have with others; sexual identity, which is more than just orientation, which is more than just us being sexual beings, but it also incorporates your values. And then there's sexual education and reproduction. We all know that there's so many women right now, young women, who are being diagnosed at an even greater rate than it has been in past decades. And so young women want to feel like, I can still have a family. I can still I guess I can still navigate and experience and enjoy my relationship the way that I did before a cancer diagnosis. So it's important that we provide the education so that they're able to do that. And then the last component that we really focus on is sexualization, and that is how culture, media, and other power dynamics influence our sexual attitudes and behaviors, specifically when you're looking at women who have been diagnosed with cancer, chronic conditions, trauma, and different ability. So I know that that was a long explanation, but I wanted to make sure that I was able to articulate why what Proud the Lab does is so important and how we think about it in a collaborative framework with the excellent care that oncologists are already providing patients.
Thank you.
Absolutely.
We're starting the after party, by the way.
Mm.
This is the part I call the group hug. This is my favorite bit. It's a group hug.